Doctor warns, want to live longer? These 4 body parts must be washed regularly. Dr. Amina sat in her clinic one rainy afternoon when she noticed a disturbing trend. Many of her older patients were falling ill from infections that had nothing to do with their diet or exercise. The common thread? Poor hygiene in overlooked areas of the body. We all think we're clean. After all, we bathe regularly, right? But according to doctors, there are 4 critical areas of the body that most people, especially seniors, don't clean thoroughly enough. And it's costing them their health, even their lives. This isn't about vanity or body odor. It's about preventing infections, inflammation, and long-term illness that can silently take hold. If you're over 60 and want to add years to your life and life to your years, this video is a wake-up call. Let's uncover the 4 hidden hygiene zones that every adult must wash properly if they truly want to live longer, healthier, and cleaner. The smallest habits often have the biggest consequences. Let's start with the first area, because you're probably missing it. Area number 1, behind the ears, a hidden bacterial hotspot. You may never think twice about your ears, but behind them? That's a different story. This area is often ignored during showers, but it's a warm, oily environment where sweat, sebum, dead skin cells, and bacteria collect. Left unwashed, this can lead to infections, chronic skin irritation, and even unpleasant odors that linger all day. According to dermatologists, the skin behind the ears can trap more grime than your feet, especially in older adults with reduced oil control or limited flexibility. If you wear glasses, hearing aids, or even long hair, this area is especially at risk. To clean it, use a mild cleanser and your fingertips to gently scrub behind your ears and in the folds daily. Afterward, dry thoroughly to prevent fungal growth. It takes only 10 seconds, but neglecting it could open the door to skin problems that affect your immune system and overall hygiene. You wouldn't ignore your face. Don't ignore what's right behind it. Area number 2, under the fingernails. Germs you carry everywhere. You shake hands. You eat with your fingers. You touch your face over 20 times an hour. Yet under those fingernails, thousands of microbes are silently hitching a ride. According to research, the area beneath your fingernails harbors more bacteria than a toilet seat. And if you're over 60, your body is more vulnerable to what those bacteria can do, cause gut infections, respiratory issues, or even blood-borne illnesses through cuts or cracks. What's worse, typical hand washing doesn't clean under the nails unless you consciously scrub them with a nail brush or use your fingers to clean under each other. Keep nails short and clean. Once a week, soak your hands in warm soapy water and gently push back the cuticles to avoid buildup. Especially for seniors with diabetes or weakened immunity, dirty nails are an open invitation for disease. Remember, it's not what you touch, it's what you carry back with you that counts. Area number 3, belly button, the forgotten pit of bacteria. The belly button, that small, quiet fold we rarely think about, unless it starts to smell or itch. But here's the truth. Your navel can house over 2,000 different types of bacteria if not cleaned regularly. But because it's dark, moist, and enclosed, the perfect breeding ground for fungal infections, yeast, and even staph bacteria. For older adults, especially those with mobility limitations or who sweat less, the belly button becomes a neglected zone that can lead to redness, rashes, and infections that spread. Doctors recommend using a cotton swab dipped in warm soapy water or alcohol-free wipes to gently clean the area once or twice a week. Be sure to dry it completely afterward. An unclean belly button may seem harmless, but over time, it can become a small infection center leading to bigger health problems. If you want to live longer, you must clean deeper, literally. Area number 4, between the toes, where fungus hides and spreads. We scrub our feet, Yes, but do we clean between our toes? This is one of the most common hiding places for bacteria and fungus, especially in seniors who may suffer from dry skin, circulation issues, or reduced flexibility. Left unwashed, this area becomes a breeding ground for athletes' foot, fungal infections, skin breakdown, and even cellulitis, a serious bacterial skin infection that can spread rapidly. Moisture builds up here after showers, and if not dried properly, it leads to cracking, foul odor, and open sores that can be dangerous for those with diabetes or immune compromise. To stay healthy, use your fingers or a soft cloth to wash and dry thoroughly between every toe, every day. Don't just rinse, clean intentionally. Also, change socks daily and avoid tight shoes. Infection can enter through a space as small as a crack between your toes, but its effects can spread far beyond your feet. Dr. Amina looked at her patient and said, "I know this may seem small, but if you want to live long, you must take your hygiene seriously." The truth is, longevity doesn't always come from big things like surgeries or diets. Sometimes, it comes from washing behind your ears or keeping your nails clean. It's about doing the things most people ignore, but that disease never forgets. So if you're over 60, remember these 4 critical zones. Behind the ears, under the fingernails, belly button, between the toes. They may seem unimportant, but they're your daily battlegrounds for health and disease. Take just a few extra minutes in your routine, and you'll add protection, peace of mind, and possibly even years to your life. Because a long life isn't just about living, it's about living well. And yes, the secret might just start in your next shower.